Hello, and welcome once again to Ask the Gynecologist. This is Dr. J here, and tonight I'll be talking about IVF in over 40s. So I know I came in a bit late today, but if you're free, join me and let's have a few minutes together to discuss issues regarding IVF in over 40s. Okay, let me try and update my connection here on my other phone. I think I'm having connection issues on Instagram. So hold on, I'm going to connect on Instagram so that people can watch us as well on Instagram. 1 second. Okay. So I'm just trying to connect on Instagram. I think we're having issues on Instagram. Hello, good evening, everyone. Good evening, Nurse Yemi, one of our IVF nurses at ATG. I think we are back on Instagram. So I'm trying to connect back again to Instagram. So if you're on Instagram watching us, apologies for that. So let us start. So today we are once again, my name is Dr. J at Ask the Gynecologist. We have Lady Grace Bature online. Princess Yemi Beck is one of our IVF nurses at ATG IVF Center. Favor Uchenna, Grace Lily Bature, Adewonke Silva. Thank you everyone for being here. And also we are live on Instagram. My name is Dr. Alalade, Dr. J at Ask the Gynecologist, and it's my pleasure to be your host tonight. We'll be talking about IVF in over 40s, the peculiarities of IVF in over 40s, why it could fail, and the things we can do to reduce failures and increase success rates for people having IVF over 40. We have, I think that's one of my junior colleagues in medical school back in those days. Leonina Campbell, Cecilia Ibimilua, Debbie Okoro, Ejiro Onome Ugware, Precious James, and on Instagram we have Moshibulaton 14, one of our wonderful members here on Instagram. We have IBKGD, Tila, and others people. I'm sorry, on Instagram it's difficult to pronounce the names because they're a little bit like acronyms. Once again, my name is Dr. J, and I'm delighted to be here tonight to discuss these things. It's a pleasure. This week has been a wonderful, busy week for me. I'm grateful that I'm here, honestly speaking. It's been hectic, but we give God the glory. We're working on so many things to ensure that people are able to afford IVF at ATG IVF Center. You'll be notified shortly. Don't forget that next weekend is our seminar. It's a free seminar, so you have no reason not to attend the seminar. If you've been looking for our free seminars, this one coming October 24th is our free seminar. We're expecting at least 10,000 people there free. So go and join the seminar now. So tonight, let's talk about IVF for those over 40. Remember, if you're a member here on ATG, there's some things that you should know about getting pregnant. 4 things must be in place for you to get pregnant. Number 1, you should be having regular sex. And when I say regular sex, I mean sex every other day or possibly 2 to 3 times a week, obviously. And when I say sex, I mean regular, unprotected vaginal intercourse. Regular, unprotected vaginal intercourse. Because sex can be different ways, though. Up, down, backyard. But we want sex to be through the vagina. That is sex that can ensure that you get pregnant. So sex through the vagina, not through the back door. Regular sex. Whether you're ovulating or not, you must have regular sex. Number 2 is that your tubes should not be blocked. And how do you know if your tubes are blocked? You can do HSG, laparoscopy and dye test, or hysterosonogram. These things are designed to check if there's any blockage in your tubes. Number 3, we need to know whether you're ovulating. Ovulation is very paramount to getting pregnant. I can see Mimi shouts. Thank you so much, Mimi. Airport styles. Thank you so much, Mimi Charles. Thank you. Yeah. Somebody said they can't hear on Facebook. I think my audio is on the highest tier on Facebook. Please I'll bring my camera a bit closer to me, but my audio is very good. So my camera is a bit closer to me, but my audio is very good. All right. So number 1, again, regular sex, regular unprotected vaginal intercourse. Number 2, no blocked tubes. HSG, laparoscopy and dye test, hysterosonogram, important to know if your tubes are blocked. Number 3, ovulation. Ovulation is paramount for natural conception. We must know whether you're ovulating. How do we know if you're ovulating? By doing the basic hormonal profile test. FSH, LH, day 21 progesterone, your prolactin, anti-mullerian hormone, all these things must be done to know if you're ovulating or not. And the last thing is that what? Guess, sperm. The sperm count must tick some certain boxes for us to know that your sperm from your husband is good. All these 4 things must happen together. All these 4 things must be in place. Now, there's some things that can make IVF difficult for over 40. And these things I'm going to talk about tonight. So stay tuned and let's go together. First of all, let me quickly welcome our members as they're coming in. Adebayo Anna, Bolahon, Unachuku Chinyere Precious, Anita Para Okachuku, Peace Udoka Badru, Ogoro Antonia Nneka, Unachuku Chinyere Precious, Mimi Charles, thank you, Debbie Okoro, Pretty Nuts, Olufowokon Lotsi Fumi, wonderful lady from America. How are you, Olufowokon? I haven't seen you in a long time. Christina Edowu Adeyemi Akomu, wonderful moderator, lovely. She's always on our posters on ATG, wonderful lady. Vivian Diko Briggs, wonderful, one of my special friends. Chioma Ogechukwu Hugamadu, Precious James Ejuro on Nomere Guare. And we also have here on Instagram, Ajo Hilebo, Miss Fretzi, Made Beauty, Praise Woruka, and wonderful people here. We're also recording for publication on our YouTube page. We are active on YouTube, active on Instagram, and we're also active on our Twitter. We have antenatal group on Telegram, GTC on Telegram, and we run our premium services, one-to-one discussion with me on our platform. We also have our ATG IVF laboratories and ATG IVF Center in the heart of Lagos, and we're working on a new laboratory in Surulere. Stay tuned. And Christmas is here. We have a special package and special gift for every member of ATG. So stay tuned to us and don't miss anything. So good evening to everyone once again. My name is Dr. Alalade, your favorite doctor. I'm not in Lagos. People think I was in Lagos. I know. About 2 years ago, I was in Lagos. And when I landed at the airport, they were trying to check my bag, at the customs now. Suddenly, a beautiful lady ran, smart lady, ran to me. Stop, don't open that, doctor. Don't open that. I said, doctor. I'm like, who is this? Anyway, she was coming in a friendly fashion. I'm like, this person maybe knows me somewhere. She said, I'm your member on ATG. I follow you all. You're Dr. Alalade. I'm like, thank you so much. And then people were wondering, what is ATG about? I'm like, don't worry. It's just me. I took a photo with this lady and I can never forget. She was so happy and I'm so happy. Even when I was on my way to honeymoon in Ghana, we stopped at the checkpoint. The person that checked us said that, yeah, Dr. Alalade, I'm like, yes. Oh my God. I'm like, oh my God. There's nowhere to hide in Lagos now. Well, all glory to God. It's our joy. It's our pleasure. ATG has stood different difficult times and we are standing. It's not because of me or because of you. It's because of God. And my prayer is that every woman that comes to ATG desiring of a solution, pregnancy, fibroid, ovarian cyst, endometriosis, adenomyosis shall meet as their solution one way or the other here in ATG without fail by the grace of God. If you key to this program, if you follow the instructions, success shall be yours. What are you doing today to ensure you're able to get pregnant before the end of the year? What are you doing this morning? What are you doing tomorrow morning? And what are you going to do to ensure that this year, 2021, does not pass you by? I've told you a lot of things on this page. You should do them. Now, let's go back to our topic of today, IVF in over 40s. First of all, people that go for IVF over 40s, there are some things that are very peculiar. You've been trying to get pregnant all the time, you're having regular sex, still yet nothing is happening. Or you're over 40, you've had children before in a previous marriage, your children before, maybe children passed away, God forbid. You've had children before, you give yourself a gap, you want to start all over again. Suddenly, you can't get pregnant. You're worried. I was going through a lady's result yesterday. She sent me 2 sets of results for herself. She did FSH, LH, and the result came back astronomical. The FSH was over 46, and the LH was about 80 something or so. And she did it all over again, and the same thing she got. So I'm like, I told this lady that if your FSH is over 30 on 2 occasions apart, minimum of 6 weeks, that means that you're probably not ovulating. Mind you, that person is not taking any hormonal supplement or medication. If that is your case, the chances that you're ovulating is very low. So I told this lady, you need egg donor, you need IVF. She was surprised that, what? I'm like, I won't lie to you. I won't be honest with you. She said, okay, how can I restock my egg if I have ovarian failure? That is what I'm going to talk to you about today. So stay tuned. Now, first of all, if you're going for IVF, okay, you've been trying for pregnancy before, you've had regular sex, you've used lubricants, still yet nothing's happening. You've had children before 10 years ago in a previous marriage, 10 years ago you had an abortion, you had a miscarriage, you're trying to start all over again, or for some reason you want desire for more children, you want more extra babies in your family. Suddenly it's not happening. You're over 40, you're going for IVF, you've made that decision. The chances of you getting success, the chances of success in IVF at over 40, using your own egg, is very low. Let me tell you the truth. Especially if you're over 45, the chances of success in IVF is probably going to be about 4 to 10. If you're over 45, you're over 40, more than 45, or even in between, the chances of success drops if you're using your own eggs and you're using your own husband's sperm. Now, let's focus on the egg. So success rate will fall because, one, the quality. The egg quality might not be very, very good because, you see, the eggs during growth as your baby, your lady, they are frozen at some point. Yemi Bekes, help me answer Monsora Todombo asking about IVF for 2 cycles. Monsora, Yemi Bekes, let me answer Monsora Todombo. Now, your eggs, they are frozen in a particular division, meiotic stage 2. They don't divide further. Suddenly you get pregnant, they start to divide. Excuse me. Because of age, the ability to divide and to form becomes difficult. Usually after age 40, 45, they become difficult. So that is why the eggs are not of good quality at that stage. Some people over 40, number 2, they are not ovulating anymore. For some reasons we don't know, they go through premature ovarian failure. But you say, doctor, my sister, younger sister is 45. She just had a baby 2 years ago. How come me? I'm just 46. I'm going through ovarian failure. What do you mean? Let me tell you something. Your sister is different from you. Yes, truly, yours truly. Your sister is like you. You might go through ovarian failure at probably the same time, maybe familial. But the fact still remains that 2 of you are totally different people. Your lifestyle, exposures, experiences are totally different, and the things you've been exposed to totally different. Stress we go through individually is different. They are different. So your sister is like you genetically, but she's different from you environmentally, seriously speaking. So yes, your sister might be having babies last year, but your ovaries might have packed up. This lady told me that, but my sister had a baby. Let me tell you something. At age 40, 45, your ovaries, if you check your FSH, they are above 35, and above 30, you're probably not ovulating anymore. Now, even regardless of your age, even if you're less than 30 or 20, I've seen people 35, you do their FSH is above 50. They're not ovulating anymore. And this lady I spoke with yesterday said that, oh my doctor, my periods has become irregular. I see maybe one today, I see 1-2 months time. That is a sign that probably you're going through menopause. You're going through premature ovarian failure. Let me tell you something. Once a young girl is developing at around age 14, 15, 16, before their period becomes regular, the period starts becoming irregular. So when a girl is getting to that age puberty, a period initially is going to become very irregular. After a while, it becomes regular. All of a sudden, towards age 45 to 50, it starts becoming irregular, regular. Then suddenly it stops. Menopause. Once your period stops at menopause, usually above age 50, 52, your period stops. That is menopause, eggs packed up. But before then, few years before then, your period is going to be irregular, then it stops. If you're noticing that at age 45, you're probably going through ovarian failure, getting pregnant might require IVF. Now, let's continue. Now, you're age 40, 45, 42, 43, 44, 45. You've gone for IVF 1 or 2 attempts, it's failed. Now, there's a concern. Apart from the egg quality, apart from the egg number, you're worried about the womb itself. The womb itself at that point might not have sufficient endometrium to support pregnancy. That is why during IVF or before egg transfer, we check the thickness of the womb lining and we ensure we want it to be at least 12 millimeter or more. That will be able to support an implanted pregnancy to grow and to grow well. Now, you don't have to see implantation bleeding at any point to suggest that you're pregnant. Implantation bleeding is not a criteria to satisfy or to be seen to suggest that your pregnancy is implanting. No, some people will see implantation bleeding, some people will not see it. So it's not a standard criteria. You don't have to see implantation bleeding to know that you are getting pregnant or pregnancy is going well. So now let's go back again to our point. Now if you're having failed IVF 1, 2, 3 times, by the time you get to number 2, stop. Before you go for the 3rd attempt, you should always consider something. Hysteroscopy. Hysteroscopy basically is what? To look into the womb cavity to see, is there something wrong with the womb cavity? Let's now go to the whiteboard here. So that is your womb. Okay? Okay? Let's draw that. So that is the wall of the womb. I'll put it in red. The wall of the womb in red. Okay? Okay? And that's the tube. Okay, coming in from this side, ovary, the tube coming in from this side and ovary. Okay, now if you're having failed IVF, it's important by the time you're going for the 3rd IVF, don't just rush into it. One thing we must do with you is to check what? Check the womb cavity. Why is your IVF failing? Is there something wrong with the womb? It's good to have a look into the womb cavity, see if there's any scar tissue. I was going through a woman's hysteroscopy result today. She did it at Owerri, Imo State, in the eastern part of Nigeria. They looked very lovely hysteroscopy video. They looked into in fact, we can do hysteroscopy for you too at ATG IVF Center. We have a good standard equipment bought in from America 4 weeks ago. We look into the womb cavity, we take pictures, we take videos, and we can see clearly. And what we do there is we take biopsy of your womb cavity, of these cells lining your womb cavity. This one. Okay? That is where we implant the pregnancy. So we take biopsy there. Okay? So we take biopsy there. Okay? Another thing is that we also check for any scar tissue in the womb cavity. So if we see any scar tissue in the womb cavity, we try and divide them with lovely scissors, very fine scissors. We also check during hysteroscopy, is there any fibroid in the womb cavity that is disturbing pregnancy from implanting? If we see any fibroid there, we take them out quickly and we ensure that there's nothing distorting the womb cavity. If we see any polyps are like fleshy, fleshy skin tags on your skin, very similar but different in your womb cavity. They can cause irregular bleeding, they can cause failed implantation, and they can make IVF not work. So we need to check your womb cavity to see if there's anything distorting or causing the IVF to fail or failed implantation. Now, how do we check the quality of the egg? Like I said, if you're over 45, if you're over 40, if you're over 45, you're going for IVF and you had a previous IVF failure, or you're going for your first IVF, I always tell people to consider using egg donor. The reason is that, let me tell you something. It's difficult for most women to accept, or men even, to accept the fact that they will need egg donor or sperm donor, respectively, trying to get pregnant. But let me tell you something. What will be hindering you for achieving your dream? Some people might say, or they know, definitely they need egg donor. They want to bring their family members or their friend or a cousin or a sister to donate egg for them. There's nothing wrong with that. But the fact is that from my experience, I've realized that if you get egg donor from a close family member, there's usually conflict of interest, very, very difficult to manage in future. But if you use somebody donating outside of your family, anonymous, in most cases, there's less hassle. Legal work, paperwork covered. There's no history, no hala. I know a lady 2.5 years ago, she came to ATG, referred her to a colleague of mine. She had egg donor. She was about 40, 42 then. She had a baby now. The baby's about 2.5 now. She's moved on. Her husband lives in Italy. They've moved on. She's trying to have another baby. Unfortunately, during the first delivery of that first child, she had a C-section. There was complications, placenta accreta. She survived. She didn't lose her womb. So obviously, she's afraid of getting pregnant again because placenta accreta makes a woman bleed a lot during C-section. She might lose her womb. She might even lose her life. So she's happy she's moved on. Now, whose business is all this? Why are you worried about what people will say if you collect egg donor? I know it's a difficult decision, but nobody needs to know. It's nobody's business. Even if they know, what do you care? They will talk about it for a week or two. they'll forget you've moved on. There's nothing wrong with egg donor. I know it's a difficult decision for most people. I know it's a difficult decision for a family member or for your husband to read that decision. You're worried that maybe, my volume is here at the highest. You're worried that maybe you think your husband will say, this baby is not yours. Or you think that this baby is only your husband's gene, it's not your gene. Or maybe you're the man, you think the baby is not your gene because it's a sperm donor and the baby is just your wife's gene. Look, I say this all the time. We are related by two things, by genes and by love. My father and mother, my father rest in peace now, they are not related. I am related to both of them, including my siblings. But they came together in love, they bore us, and they've moved on. Two of them came together by love, but I'm related by gene to them. People come together on the basis of love, and some people have seen that they are even related together. They don't even love each other. But people that are even just friends through love, they are friends for life. The most important thing is that if you have love and if you are related, it's a blessing. But even if there's no blood relation between two of you and you have love, love can conquer anything. I've never seen what in this world that love can't conquer. I'm yet to see anything that love cannot overcome. Love is like water beating on a rock consistently. That rock will split in a matter of time. Don't let love fail. Let love guide us on. Now, let's go back to our point again. Now, people trying to get pregnant over 40, another difficulty they might have is that once they get pregnant, they develop diabetes, blood pressure complications, and all that. And sometimes the pregnancy can fail in the first 12 weeks of pregnancy. That is why if you're going for IVF, you're over 40, I always encourage people to be on aspirin, 75 milligrams or 150 milligrams to ensure and to reduce the risk of failure. Especially if you have blood pressure problems, you might benefit from taking aspirin at least a month before you get pregnant. And take the aspirin all through pregnancy till you deliver. It does not do any harm to baby. It doesn't do any harm to placenta. It increases placental function and make the IVF and the baby survive better. Number two, if you're over 40, you are more likely to have blood pressure problems, complications, and diabetes even before pregnancy, or thyroid problems. That is why if you have any of these medical problems, diabetes, kidney problem, blood pressure problems, uncontrolled diabetes, thyroid problems, you must see a physician and get them well controlled, well managed before you get pregnant. Because if you get pregnant without proper control of diabetes, pregnancy can fail. Pregnancy can miscarry, and sometimes too, the pregnancy you've paid so much for to get can miscarry, and you start all over from square one. I talk to people every day. They want to get pregnant in Germany, in America. I was talking to a lady today. She's trying her best, but the problem is that she knows now. She came to me trying to seek my second opinion, which I love. I love people trying and seek a second opinion, and I always encourage my patients to seek second opinion outside my own advice. So she came to me, registered an ATG yesterday, platinum service, talking to me one-on-one. She sent in her results to me. I looked at them and I told her, from what I see here, your eggs are not functioning well. You need egg donor, to be honest. And I also told her, apart from that, your husband's sperm count is 2 million is very, very low. To get pregnant, both of you will need ICSI. Okay, that is a form of assistance we give men to ensure that they can get pregnant if they have sperm problems. So she will need egg donor because there's no egg there. She will need ICSI to assist her husband so that they can move on. Essentially, they will need egg donor, they will need sperm donor, and it's going to be a bit expensive. They're happy. In fact, the lady said, what you said, doctor, is exactly what I've been told in America. I won't mention the state. And she said, I agree with you. How can I proceed? So I'm working with them, with Dr. Chioma and Dr. Babajide at the IVF center to ensure that they can get pregnant as soon as possible. And that journey, I believe, is going to be a successful one. If you're an ATG, if you're following me, I want to tell you something. There is hope. If there's no hope, I will not be here. If there's no hope, I won't be telling you. My life experiences could be different from your own. Yes, my challenges could be different. But I can tell you something. I'm a general with scars and I understand some things. What I've seen might be different from what you're going through. Definitely, it can't be the same thing because my shoe is different from your shoe. But at the end of the day, let me tell you something. There's always light at the end of the tunnel. No matter how difficult your journey is, somebody has had it your way, difficult than you, or even maybe a bit better. But at the end of the day, you can't wear around your badge of dishonor and say, I'm suffering. No, come and see what I'm going through. I can't get pregnant too. Yes, you're going through something. Yes, you're going through issues. Yes, you're going through challenges. But you're praying, you're trying. But don't lose hope. You need to take consistent steps to achieving your success. Now, if you're ready to work with me, we can work with you. If you're over 40, over 45, you can get pregnant through IVF. And it's happening at ATG. If you've done IVF twice, it's failed, before you proceed for the next IVF or anything else, you must first of all consider hysteroscopy. We need to check your womb cavity. Some things seen on hysteroscopy, scan cannot see. Some things we see on hysteroscopy, scan cannot see. And what is hysteroscopy? I did a video over here some few weeks ago. I talked about 3 things: hysteroscopy, hysterosalpingogram, which is HSG, and hysterosonogram. And I differentiated all the different components of these 3 things and why they sound similar and what they do. Some things ultrasound scan will not show clearly. Some things CT scan will not show clearly. Some things, will not see clearly on these imaging things. But hysteroscopy will give clarified view. Hysteroscopy is a direct camera to look into your womb cavity and to resolve anything wrong in your womb cavity that might be causing recurring miscarriages or failed IVF. Some people, it's not even IVF they've done. They're having recurring miscarriage all the time because some things are wrong with their womb. Hysteroscopy will fix it. Odumbo, Yemi is already chatting with you to sort your problem. So Monsogat Odumbo, follow Yemi. The screen, thank you on Instagram here. Awa FFP. Now, I know people already have questions, so I'm going to quickly start taking questions here because people just want answers. And I tell you something. You are my business. You are the reason why I'm here. And my joy is that if I can help that woman listening to me, if that lady that needs that baby listening to me, if I can help, today is my joy that your salvation is here. My joy is that every woman that comes across ATG, every desiring mom coming across ATG shall get her answers, shall get her prayers answered. Let me tell you something. If you're a woman, you want to get pregnant, it is your God-given, undeniable right to get pregnant whenever you want to and if you want to. It's your God-given, undeniable right to get pregnant if you want to and whenever you want to, by the grace of God. And this is what people like me, all over Nigeria, IVF centers, including ATG, have desired that you be able to make it too. Like I said again, Ogunfolu Folake Olumide is asking, one of my tube is faulty. What is the solution? Let me tell you something. You only need one tube to get pregnant. Obafriye, thank you so much on Instagram. You only need one tube to get pregnant. As far as one tube is okay, that's all you need. I've seen people that they've lost one tube from ectopic pregnancy, and I can testify. And people watching me, I can tell you that some people here watching me, listening to me, they've done ectopic pregnancy, they've lost a tube, but they are pregnant yesterday. They are pregnant today. They've had children. As far as that leftover tube is okay, it's enough. Once you get pregnant, all we need to do is to do a scan to ensure that your baby is in your womb and it's not ectopic. Doctor, first time I want to try IVF, is it appropriate to go for 3-2-1 baby? If you're going for IVF, in most cases, we transfer only 1 egg. In some rare circumstances, we transfer 2 eggs. In some cases, we put in 3, depending on the egg quality. But we try and ensure. Please don't put your numbers on this page. You don't know who is watching you. Don't put your numbers here. Please, if you want to contact us, just text the ATG IVF Center tomorrow morning, 9 o'clock they'll be opening. Yemi will attend to you, okay? So if you come to ATG IVF Center, before we put in your eggs after the retrieval and fertilization, 6 days post-egg retrieval, we ensure that your kidneys are functioning well, your liver is functioning well before we put in 2 eggs. Okay, in most cases, we put only 1. In very rare circumstances, we put 2. Okay, depending on the egg quality. Good evening, doctor. I'm breastfeeding mom. I just found out today that I'm pregnant. What can I take Dufastone course? Dufastone, if you're pregnant, you don't need Dufastone. You're pregnant, you're fine. All you need to do is to do a scan around 6 weeks into your pregnancy to check that baby is okay. Good evening, Mary Okira. Thank you, Christina Idowu, Adebayo Adeola, Sharifat. God bless you. How are you today? Obafri, can one get pregnant normal after failed IVF? Yes. I've seen many people, they've done IVF before, it's failed. While they're getting ready for the second one, they got pregnant while waiting and while expecting. So you can get pregnant for even after failed IVF. As far as your tubes are not blocked, husband sperm count is good, you're having regular sex, and you're ovulating, okay? Good evening, Franka Okuobi. Thank you, Chinenye Anya Wezima. Tomorrow morning, what you should do is to call ATG IVF Center and start that journey for on the way to motherhood. Don't delay. Don't let this year pass you by. This year is almost over, but it's still there. You see, you don't know what God has in stock for you. You don't know what is next door. You don't know what is around the corner. So, let me tell you something. ATG started at the most difficult point in my life. And if I'd given up at that point, I know if I'd given up, maybe I'll not be here today. So what I'm saying is, don't give up. Don't lose hope. There's still, as far as you're still breathing, as far as you're still alive, you're still consuming air, you can still move, you can hear me, you can see me. There is hope for you. That I have no doubt about. I'm in UK, but our ATG IVF Center is in Nigeria, and we have competent doctors there, which we manage and work together to get you pregnant. How can one get something OHSS? I didn't see that. What could be the cause of 2 IVF, 1 FET, 3 IU and 33 years, PCOS, oh my God, on one tube? My sister, get hysteroscopy done. Let's check your womb cavity to know what's going on. That's too much okra for Chioma. Let's look into your womb cavity to see why all these IVF are failing. Doctor, is it possible to get pregnant through IVF without regular menses? If you are going for IVF, we don't need your regular menses. We take care of that, okay? If you're going for IVF, you don't need your menses again. We take care of that. Good evening, doctor. Please, how long does something? Good evening, doctor. Can someone get pregnant with just one tube? Obanum Naomi, yes. Can one get pregnant with a cyst? Yes, Jenny Habe. You can get pregnant with a cyst. But if the cyst is bigger than 4 centimeters, I'll suggest you take it out before trying to get pregnant. What if you're 40? Once you're 40 and above, your chances of success with IVF using your own eggs is about 4 to 10%. How can one prevent OHSS and what causes it? OHSS is caused by when we stimulate the ovaries with some medications like Clomid and some other IVF medications. During IVF, OHSS is very, very common. In fact, OHSS is a common complication of IVF. What we need to do is to give you the right dose for you for IVF. So for giving you any dose of drug in IVF, we measure your weight so that we give you the dose that you need to prevent OHSS. If you see that your ovaries is going to be hyperstimulated, there are other protocols we use in our IVF center to reduce the chances or the risk of OHSS. You're 41 years, so can you use your own egg? You can use your own egg, but your chance of success is going to be very low. If you're over 41, you want to get pregnant, you want to use eggs, I suggest you use a donor egg from a young donor that is very, very of good quality. Can hypothyroidism cause hyprolactin? It can in some ways. Hypothyroidism can cause hyprolactin in some ways. Barbara Edos, true. Uzo Ujunwa, you need my number. Go through our premium services. Uzo Ujunwa, our numbers are. Thank you. So thank you, Christina, for already answering Uzo Ujuma. Can IVF be successful with adenomyosis? Yes. Yetunde United. Adenomyosis does not stop IVF from success in most cases, okay? So adenomyosis does not stop IVF, okay? Thank you. Does diastatic recti have any health implications? What is diastatic recti? You see, when you're pregnant, your rectus abdominal muscles can separate as the baby is getting bigger and your tummy is stretching. When that muscle is, there's a muscle in your tummy called rectus abdominis. Once it's separating because your baby is getting bigger, it causes pain. But it doesn't do any evil or any harm to you. Once you've delivered and you start to gym back, the muscle will come back to where they are. Do you have to see the donor? Our donors don't want to be seen, okay? They are anonymous. In fact, you don't want to see them. But what we do is we match complexion for complexion. We test them for all known diseases that are transferable, ensure that they are healthy, and that's all. You don't see our donors, okay? It's confidential. All right. Sandra Gids, thank you. Shabniz Hussein, welcome to Instagram. Jamvi Badnotra, Theo Beauty, welcome to Instagram. We are still here live on Facebook. We are still live recording on YouTube. And Sandra Giddis, can one get pregnant with polyps? If you have polyps in your womb, and we've seen it through hysteroscopy or through ultrasound scan, I'll suggest you remove them before going for IVF. Please remove the polyps before proceeding for IVF, okay? Thank you. Thank you, doctor. What happened when one do menses twice a month? Probably you have infection, you have a fibroid, you have a polyp. Do scan hysteroscopy so we know what is there and we can get it sorted. What can cause miscarriage in 4 weeks pregnancy? Failed implantation, issues with luteal phase deficiency, chromosomal abnormalities, infection, bacterial vaginosis, uncontrolled diabetes, uncontrolled hypothyroidism, antiphospholipid syndrome. These things can cause miscarriage in the first 4 weeks or in the first 12 weeks of pregnancy. Doctor, what can cause cramps after menstruation? Is part of menstruation. Menstruation can happen and can cause cramps because you have a fibroid or just because of progesterone hormone. It's normal. What we need to do is to give painkillers to treat the cramps during menstruation. Thank you, Liz Queen. God bless you. Okay, Ojoyin Ojope. I think you got that answer, right? God bless you. Thank you, Liz Queen, on Instagram for moderating here. God bless you. Wonderful lady. We are on Instagram, live on Instagram. We are on ATG YouTube. We publish our videos on YouTube consistently. You can watch our programs there. And if you need supplements, your Fertility M, Fertility M is for men, Fertility F is for female. You need your Adizwa, you need your Proceed, you need your lubricant during sex, pre-seed lubricant. Get them all at the ATG IVF Center. We have supplies there. Just call the center. Yemi, Nike, they'll call you and they'll tell you when to come and pick it up. Ferry, Mena, Oposi, welcome. HSG, can it be done twice in 2 months? Why do you want to do HSG twice? You've done HSG, one should be enough. In very rare circumstances, we repeat HSG, but one should be enough, okay? How long will you need after fibroid surgery? If you have fibroid surgery, give yourself at least 6 weeks to 6 months. So give yourself 6 months for full healing after fibroid surgery before trying to get pregnant, okay? Doctors' borders are closed. How can one come to your place? Fly into Lagos. Come by road. I don't know where you are, but I think I'm not immigration lawyer or immigration expert too, but I know that if you want something, you will find a way. And if you want something genuinely, God will make a way for you. What causes headache in pregnancy? Some people do suffer from migraines. Yes, and migraines usually is better in pregnancy. But if you're dehydrated, you have malaria, typhoid, all these basic infections, they can cause headache, or even stress itself, they can cause headaches in pregnancy. How much is LEKKIIVF? Just Toshanjala, call my center tomorrow morning, okay? And Nike or Yemi Bekis, she will tell you the cost and she'll tell you how you can get them and how you can pick them up at our office. We don't ship out. You have to pick it up or get someone to come and pick it up for you, okay? Can a 41-year-old still get pregnant naturally if she's ovulating? It's possible. It's possible. I don't care about that. You need to have regular sex. There's no tube blockage. The sperm is okay, and that's it. Doctor, can a man get his wife pregnant with sperm count of 25%? Very, very unlikely, okay? But there's nothing called sperm count 25%. Is that 25 million and above? Usually we want 40 million or more to get pregnant, okay? When is the best? So if your sperm count is low, pick up Fertility M at the ATG IVF Center. Call the center tomorrow morning, and Nike or Yemi is already on this line. She'll tell you how to pick it up. How long will you stay in Lagos? For IVF itself, okay, you should plan to be in Nigeria for at least 6 weeks. If you're coming in from outside Lagos, you can come for your consultation, start your medication. We'll give you time to come for your egg retrieval, and we'll give you time to come for your egg transfer. So you can come into Lagos by road, and after your egg transfer, we'll tell you to get some rest before you start your journey back to your base in Nigeria. So all this will be discussed with you when you come to our IVF center, or if you call in tomorrow. Does your IVF center do data selection? Yes, we do family balancing at the ATG IVF center. For people in Nigeria, we do family balancing. Yes, we do that, okay? What could cause a pregnancy of 16 weeks? What have to be broken? Maybe infection, maybe weakness on the cervix, okay? This can cause weakness and can cause water to be broken. Or trauma or abruption, very rare. Can someone take folic acid and Centrum prenatal vitamins? Yes, it's okay, but all you need is pregnant care, or folic acid is enough, okay? Thank you, Han Chidima Audrey, for coming up here. Ineka Obabubdike, thank you so much once again. On Instagram here, we have a question there. What is the negative effect of steroid injection given at 32 weeks due to threatening? So Steroids has no negative effect, okay? It's given at 32 weeks if we're suspecting preterm labor to mature baby's lungs in anticipation for earlier delivery. However, if we need to give you multiple doses of steroids, it can cause baby not to grow well, but it's very, very rare. But 1 dose of steroid or 2 doses of steroid is not going to cause baby any harm at all, and is given to babies through injection to the mom before baby is born to accelerate baby's lung maturity, and to in case that we have to deliver baby much earlier, baby will have a good head start. That's all. Doctor, how can I take care of my daughter's public care? I don't know about pediatrics, okay? So you need to see a pediatric doctor for that, okay? Or you need to see a pediatric doctor for that. I'm just confirmed I'm pregnant today. Congratulations. You're in second IVF round. You need good tips for pregnancy. You need to register for the ATG antenatal. Please help me register this lady for the ATG antenatal. When can one get hysteroscopy? We can come for hysteroscopy at the ATG IVF center. Just call tomorrow morning, and Nike Yemi Becky, she's online here. She will tell you how you can book an appointment for hysteroscopy at our office, okay? Is IVF expensive? Snow White, IVF is expensive anywhere in the world. Let me tell you something. There's nowhere in the world that IVF is not expensive. In America, it's close to $15,000. In UK, it's about £8,000. It's expensive. It's not a lie. In Nigeria, it's actually cheap. If you look at the cost of IVF in Nigeria, it's less than £2,000, about £1,500. Actually, it's cheap compared to most places on earth. I know, relatively in Nigerian currency, IVF is still expensive in Nigeria, but on a wholesome level, it's actually affordable. It's actually relatively cheaper. I know it might not be affordable for some people. True, I'm not saying it's cheap, but I'm saying that it's still doable in Nigeria. You can do installmental payments. You don't have to pay whole to go IVF. You can pay. In fact, most people that come to our office anyway, they do installmental payments. And Yemi will guide you along. Nike will guide you along. Dr. Chima will talk with you and she'll work with you. I've never seen people working with joy in anywhere in the world like I see at the ATG office. What is the cost of pregnancy having 2 sacs in a womb? You got twins, and then only 1 baby in it. Maybe 1 baby miscarry. It can happen. Just like normal pregnancy can miscarry, twins too. In twins, 1 of the twins can miscarry. It's not unusual. It can happen. God forbid, though. Thank you so much, Ekuga Ebere. Are you saying IVF over 40 is doable with 1 egg? I'm not saying that. I'm saying that IVF over 40 with your eggs is unlikely to be successful. Only 4 to 10% chance of success. If you want to do IVF, you're over 40, I'll suggest you use egg donor with good quality egg. However, if you are adamant that you want to use your own egg, as far as you understand that the chance of success is very, very low, that's okay. It's your choice. I cannot force egg donor on anybody. I can only advise. I can only guide. I cannot force you to do something. I'll suggest if you're over 40, use egg donor, okay? But if you insist that you want to use your own egg, as far as you understand that the risk of success, the chances of success is much lower, then it's up to you, okay? If you're over 40, you're using your own eggs, the chances of success is 4 to 10%, okay? Surrogate, we don't do it, but we have an agency that will call in and they'll sort you out. So if you want to do surrogacy at our ATG IVF center, we will refer you to a surrogate agency that's attached to us, and they will take it from there. All the legal paperwork, they'll sort everything out for you, okay? All right. We can't do everything, but we have this agency that is affiliated to us that will refer you to them. They'll sort out all the paperwork and all the other things about surrogacy, and you'll be taken care of, okay? Our office is in Lagos only. Now, I gotta go now. We're getting ready for tomorrow. Tomorrow again, we'll be here live again by God's grace, and we'll be talking on so many things. Tomorrow is going to be a wonderful time. I don't want you to miss it. I'll let you know the time anyway. We are bringing out a good package, a wonderful Christmas gift for everybody here on ATG. Stay tuned, and hopefully see you soon. God bless you. Oh, Cynthia, I already answered your question, okay? God bless you. Have a wonderful day. Have a wonderful weekend in advance. Love you all. Bye-bye.